Welcome, everyone, to today's webinar, What Healthcare Can Learn from Supply Chain-Driven Industries. I am Brian Zimmerman with Becker's Hospital Review. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to start things off by introducing our presenter, John C. Harvey. John is part of Oracle's Business Value Services organization and has more than 20 years of consulting, business development, and business transformation expertise within healthcare organizations, specializing in the delivery of business process and technology solutions necessary to improve organizational performance. He brings significant expertise in enterprise resource planning systems, including Oracle, PeopleSoft Supply Chain Management, and Financials. And he is a thought leader in provider SCM operations. At this time, I'm pleased to turn the floor over to John to begin today's presentation. Take it away, John.
Hello, good morning or good afternoon to everyone. Thank you for joining us today. I'm going to just spend some time with you today to talk about some of the things that we're hearing about in the industry, talk about what organizations are looking to do and kind of how we've gotten to where we are today, but also share with you the supply chain continuum, take a look at where some organizations are and how we can push ourselves along that supply chain maturity curve in order to improve our overall processes, and also share with you some disruptive technologies that we can leverage today to achieve operational excellence within our organizations, and leverage really some functionality and processes that are a bit more mature in other industries that really in our space we haven't to date done a lot of, particularly around demand and supply planning, and really with the times that they're happening now with COVID and the pandemic, but we've also seen these before with solutions and gown shorts, et cetera, that it's probably more of a function that we should be looking at a bit more heavily, and begin to adopt some of those practices that work well and really drive some more efficiencies in other industries leveraging these tools. So when we talk about overall operational excellence, I'm not going to go through kind of what the challenges are that are facing us today because you all live and breathe this industry. But I think some of these statistics are very telling to me is that to date, we have over 90+% of hospitals are now using electronic health record, right? We had Y2K. I know we're going back 20 years now, but we had a big push on Y2K, the first wave of ERP implementations. Some organizations began to really take advantage of kind of what we would call the wave 2. Once their original ERP was in, kind of improving their processes, but then all of a sudden we were faced with the need for the electronic health record. So the focus kind of came off the back office. Organizations were faced now with having to implement electronic health records. There's been a lot of consolidation in that space, a lot of maturity in that space, and now we're back up to 2020. In the past couple of years, organizations realized that they need to start looking back at their back office, right? Some of you on the phone here now, you're beginning that cloud journey. Other organizations are still sitting on legacy technology, some of it very vintage in a way, sometimes 10, 15, 20-year-old implementations that you're running on. But really, we talk about operational excellence in that we've implemented the electronic health record, we've tweaked the health record, it's now being utilized. However, we're not getting all the benefits out of that. And we need to start looking at focusing on the back office again, but really then driving integration between our clinical and our back office. There's some preliminary integration and some processes that have been established there, but we've really taken advantage of the full functionality of both those tools and being able to really operationalize and improve our processes overall. I think when you just look at some of these statistics, you can see underutilization of equipment, understaffing is still going on, so we're really looking at our demand, and we're really looking at our case schedules, et cetera. When we talk about operational excellence, right, it's really leveraging and taking advantage of the technologies we put in, right? Some organizations will say, I have all the technologies I need, right? Now it's improving and updating those technologies, specifically in that back office space, keeping up to date on those technologies, but really beginning to take advantage of the power that this technology gives you, right? With newer technology, we're able to take advantage of the disruptive technologies, which we'll talk to a little bit later, around, chatbots and Internet of Things. Other industries like retail and banking, they've been doing this for a long time, right? Customer service, right? Customer experience, right? What are we doing from a call-in standpoint? And how can we take advantage of these to really improve the overall experience, not just of our patients, but of our employees and the overall communities that we serve. And really, when we talk about that, it's, operational excellence needs to be throughout the entire organization. Again, we've been siloed in the past. We had, as I mentioned, the back office ERP implementations, wave one, then we have the clinical side, but really it's time that we take advantage and look across the entire organization and look to how we can basically be improving overall processes. How do we continue to focus on the end result? We talk a lot about quadruple aim, the overall patient experience, employee experience, right? So it's, again, leveraging technologies from a clinical side, improving our back office, pulling those together and overall improving just the way we function, do work, in order to continue to be scalable, more resilient, and be able to grow with what we're going to be able to see happen in the industry here as we come out of these challenging times. I use this quote a lot from Tanmay Rova. About change fixes the past, transformation really creates our future, right? So we often will just cover up and Band-Aid and fix some things we've done in the past, but we're really preparing for where we need to be and where we want to go. So when you think about moving and taking advantage of some of these technologies, it really is not thinking about, well, that's how I do it today, how can I do it in the future? It's how am I going to do it in the future to really transform my business and really be, the best prepared organization for all the challenges. We know that with, that had the foundation of operational excellence is really how that integrate enterprise. I mentioned earlier, it's bringing these two sides of the house together, right? The financials, the HCM, the supply chain, as well as the clinical together. And again, here's just some more statistics to share that, with having those integrated just by total cost of ownership, by having an integrated solution, getting rid of some of these best-of-breed solutions, you're able to save, almost 40%, right? Overall, HR and financial leaders and supply chain leaders see just an overall performance, over 70% just by taking advantage and focusing on improving their processes. And parts of this is already taking shape, right? Again, I don't see everyone who's on the phone yet, but, a number of organizations have begun to take these processes under control. They're beginning to implement some of these solutions. But I find that this statistic, to me, is very telling. 85% of healthcare is now occurring outside of the hospital. Right? So that means 15%, roughly, of care is done inpatient. Yet we spend a lot of time, right, managing what's happening within the inpatient setting. But what are we really doing to make sure that our freestanding emergency rooms, our ambulatory surgery centers, our physician practices outside of the hospital are really taking advantage of the contracts that you might have in place? Are they leveraging the right items that you're putting under contract? Are they following the same rules and policies that are put in place at the centralized hospital? So, we really need to begin to look outside the walls of the hospital in order to make sure that we're providing that same level of care and the same level of service and consistency throughout the health system. So when we talk about with customers, it's needing to simplify, right, our supply chain and then just make that more powerful from a technology, right? So how are we going to do that, right? We talk about kind of three main things. It's overall increasing automation, right? So getting rid of the manual handoffs that we tend to have and exist in a lot of our areas, from sign-offs to secondary approvals to clearing or overriding a voucher or an exception for a payment, right? I know we overuse that term automation. It's something that we've been talking a lot about. Maybe we've missed the boat on that, in the first rounds of ERP implementations. But really, it's leveraging, again, the auto process automation or robotic process automation that we have in these new technologies to really automate the mundane, the routine, so folks could be, and your resources can be focused on the more important things they need to be doing. Further integration, right? And I mean that kind of outside the walls of the hospital, right? How are we really going to change our supply chain if we're not communicating effectively with our GPOs, with our distributors, with our other suppliers? Are we sharing our demand, right? Very few organizations really share what their demand is going to be, right? So we're relying on our major distributors, we're relying on our suppliers to kind of know what we need, or look at average monthly usage, right, to be prepared for us, right? And we're waiting on those out and really relying on those allocations. So how can we drive further integration just to improve overall, information sharing across the entire ecosystem of our supply chain? And the third point there is truly around demand supply planning, right? If we do a better job, and I know our industry is not completely ready for this, right, but something I think that we together as an industry need to work on is if we can better prepare and do a better job around demand forecasting, supply planning, so we can begin to minimize stock outs, minimize short shipments, which we know that those short shipments then call for substitutes to come in. The substitutes cause issues on our PARs and inventory and need to measure and quantity issues. It causes contract pricing issues and invoicing issues, right? So if we could do improve our processes overall, making sure that we're sharing that demand to make sure we have the right items that we have on contract where they need to be, and again working together with our suppliers, and that's a stepping stone that we need to be working on, but we could certainly improve a lot of our downstream processes based on that. So I'd like to use this graphic from Gartner, and it's a number of years old at this point, but I think it still holds very true, right? So many of our organizations from a supply chain perspective sit at the stage 1 and stage 2, right? I wait for a par level to be counted. I receive an order and I just react, right? I wait for a min to be triggered down on my perpetual inventory. I send an order out, and I hope that my supplier has enough quantity on hand to cover what I need, right? A lot of us don't even look at safety stock a whole lot. We're kind of riding on mins that might be, fairly a number of years old. Some of our par levels in some of our organizations have been the same par levels for, quite some time. The more mature organizations might be working with their floors and work with their end users or their customers, adjusting those pars. But very often we see that we're living with pars and reacting to long weekends and those types of things just by manually doing that, right? So, stage 2 would then be anticipating. I'm starting to look a little bit more into what I think I'm going to need. Some of us do that in some level when we know we have a long weekend or holiday coming up, but there's really not a whole lot of science behind it, right, or technology behind it. We're just manually upping our storeroom replenishment order and then, waiting for that order to come in. As you come along that curve is around, truly integrating with our suppliers, collaboration with our other partners in the ecosystem to full-blown orchestration, right? And, we've had experience with organizations in different countries where they do some more of the integration. Even here, a number of organizations do that. But what does that integration, the collaboration orchestration mean? Depending on the goals of what your organization may be, with the services you want to provide moving forward with your health system, what are you as supply chain leaders going to be doing to support that? An example is, more home health or busy nurses, right? So that's a direction some organizations are going, long-term care, right? So how can I, as a caregiver, be out at a patient's home, check on them, and possibly be able to place an order for supplies they need from home, right? So again, it's what are the technologies that are needed in order to support that, right? So you need an order management, right? You need to be able to do a bill from there, right? Again, not things that we typically would do in our space, but there are some orgs that do this. I've had a personal experience myself where, a family member was in a hospital, they were discharged, By the time we got home, an hour later, a truck pulled up from the health system and delivered all the supplies that we needed for wound care and some other things, right? So that was truly a collaborative and more orchestrated supply chain. I didn't need to go out and get medical supplies from a medical supply store. I didn't need to go to the pharmacy to pick up meds, and meds were delivered as well, right? So you think about where are you today, and many of our organizations, we sit at stage 1 and stage 2, and that's just the way we have been, right? And we're going to continue to suffer with the issues that we have related with that around short shipments and subs and stockouts, et cetera, if we don't try and come along that curve, right? And we do have the technologies available today because as you know, and you all live, when you do shopping and online retail, and you can log on to those websites and you can see what the quantity on hand is available. I can check on a big box store, and if I really need something today on Saturday, I can look to see what stores in a 25-mile area might have that lawnmower that I need because my lawnmower broke down. I can see the quantity on hand, right? So that technology exists, right? We just tend to not leverage that technology because we've always lived in a reactionary mode, right? I know that if I'm not really managing my inventory, not really managing my supply chain. If I stock out something, we have fairly short lead times, in the United States. So I know I'll get tomorrow. I know I can call my rep and get something rushed in for tomorrow, right? So we continue to live with, this reactionary mode, and really with the times that are occurring now with the pandemic, we certainly see that that's not always going to hold true, right? Hopefully we don't have something like this again, but that still doesn't keep us from, really beginning to prepare and do a better job of that. So I've talked a bit about this disruptive technologies, and again, how do we leverage these technologies to just overall improve processes within our organizations so that, again, we can be giving our caregivers a bit more time, with the patient. So some examples we talk about around chatbots, right, and digital assistants is I need to place an order for 4x4s for this room, right? That could be a caregiver. It could be a caregiver asking for, any type of item, right? Maybe some of you are thinking now, well, my org, our caregivers don't order like that, but really the example is whether it be a caregiver or an inventory control clerk, they say that there's a statistic out there that caregivers spend 7 to 10 minutes per shift looking for supplies. That could be a med surg supply or it could be a pump that they need for that room, right? So again, it's leveraging technologies to take away, right, that need for them to have to go find either sewing materials or to go back to their workstation, right, to be able to sit down and actually place an order and wait for it to pick up by leveraging chatbots and all using our mobile devices just to go ahead and place an order, right? We all do this at home now, right? Maybe not all of you on the phone, but now with our Google Dots and our Alexas, I kind of say that quietly because I don't know if people are home and this is now going to wake up Alexa, but people are placing orders at home, right? Our caregivers and our employees of our health systems, they want to have that same technology, right, and leverage that same ease of technology and that interface to the technology at work as they do at home, right? That same caregiver could then the next day ask their mobile device in the chatbot, hey, what's the status on order, right? Or maybe, from personal experience, or the head of the case manager for OR or the head of materials for the OR, they're thinking about case tomorrow, and like, oh wait, I put in that special order for a case tomorrow. Let me just, as I'm walking down the hall, check on the status of order. Again, they're not writing a note on their hand. They're not forgetting to go check on that order when they get back to their workstation an hour later. They actually just use the modern technology to do that. Other examples are, some of you on the phone here, you might be walking to an order with a supplier, and you're thinking, oh, wait, what was my spend last year with them, right? Rather than having to go run a report, email someone, give you that report, leveraging a chatbot to say, what was my total spend last year with supplier X, and that information coming back to you. So lots of things that can be done. With chatbot technology, you can ask that report, and you can also then push that report out to your direct reports, right? So again, it's making your processes and your operations run more efficiently, achieving operational excellence, right? All while giving you the ability to make decisions faster with more reliable data. The second large area we talk about adaptive and machine learning is and we have lots of these examples, right, within healthcare, but you talk about the anomalies, right? So, for supply chain folks, it's always that random order that someone meant to place an order for 10 each, but they actually ordered 1,000 eaches, and that order actually goes down the storeroom or goes down a PO, and it just auto orders, right? So with anomaly detection, just one example is, the system would say, hey, John, you generally only order 10 of these. Did you mean to order 1,000 of these, right? We talk about predictions, right, or recommendations, right? So, hey, here's an item. I just got back order for it, right? And the system is learning behaviors, and every time this item has a back order, you've subbed in with this item, right? So why don't we go ahead and do that, right? Or a recommendation on, we all spend a lot of time and resources really on, invoice exceptions, right? So let the system learn that this was, this invoice exception or this match exception came from a requisition that Joe may have placed, but it was a valid requisition, and it was approved by Joe's manager. It was bought or put on a PO with a contract supplier. We received the full quantity of it. The pricing looks right, but let's say, for example, they short ship something else, so the invoice lines 1, 2, or 3 don't match the PO lines. Maybe they dropped out number 2, so now it's just being invoiced for 1 and 3, and we get a match exception for that, right? So again, let the system make recommendations that this all looks good. Let's go ahead and pay it. Because ultimately, there's some number, right, that 75% of our match exceptions get overridden anyway, and we just pay it. Yet we spend a lot of time and money doing that, right? So, again, it's not something that you see in other industries necessarily, right? And it's leveraging technology to help us do that. The same thing around trend detection and predictions. And we're going to talk about that a little bit more about that later. These are just some other examples around, adaptive intelligence, but dynamic pricing, optimized demand sensing. We also talk about replen sensing. So there's some technologies that we personally are working on right now. We're releasing parts of that around, I mentioned about PARs earlier, but, it knows that Friday, the PAR level is typically 4, but to Friday, let's go ahead and up the PAR level to 6. On Monday, it lowers it back down to 4, right? The system's also smart enough, though, that the PAR level is 4. Today's Friday. Monday's a holiday. Let's go ahead and up the PAR from, say, to 8. Let's fill that up, and then on Tuesday, let's bring it back down to the original 4, or whatever that might be, right? So again, these are ways that we can leverage the technology in order to make sure that we're providing the right level of service and the right level of supply, so our floors and our end users, right? But not really having to make more work on our PAR folks or our inventory supply chain folks in order to manage those PARs. Let the system make those recommendations and then adopt them accordingly. Supply chain is something that, I put on here. I think it's something that, it's a hot topic for right now, and we're seeing some work being done around track and trace, around manufacturing of implants, et cetera. I like to use a very simple example around supply chains, and we can just get all of our industry working around supply chain and really just reducing that friction supply chain, our trading networks, right? So, leveraging supply chain around just the use of what we're used to now with EDI, right? But just trading purchase orders and invoices, confirmations that are much more readily and more efficiently than leveraging, what we've been historically doing around, more legacy and older technology. And then really it's what do we do with this, right? So, I want to just give some examples around, analytics with, again, these are areas that we've been pulling together this three-legged stool for some time, but leveraging the reporting that's available in these newer technologies, right? You're able to always hit and pinpoint, hit your real-time transactional data. You're not working off of, a data warehouse or repository that might have a lag time of a couple of days or sometimes even a week, depending on the organization, right? So it's pulling together that and truly integrating your clinical data with your financial data, with your supply chain data, right? And here's a couple examples of being really then be able to get real-time information on kind of what is my total spend for this department? Where is it happening? Where am I trending, right? All this type of information now with what we like to call the thrill of the drill, it's much more actionable, right? You can click on any one of these. I'm not going to do that just for the sake of the presentation, but I can click on here, what's my total supply spend, whether it be my entire organization or based on my security. I'm only looking at the information that's available to my department or my organization, right? And then drilling down. So in this example, it's, looking, there's supplier performance over there. Let me see what's doing. How are they doing from an on-time delivery? How are they doing as far as their compliance on hitting their delivery times and what they're delivering to me? Are they meeting the needs and service levels? Here you can drill down to total number of cases. You can look at overall service line profitability. Again, because we can now begin to better pull together information much more efficiently with these cloud technologies, right? So the interface lags and the efficiency of the interfaces are there, and able to have more real-time actionable data by which you can make decisions and really support just overall action and decision-making within your organization. So here you can drill down to different departments, right? You can even then begin to look by department, even look at, cases by doc, total supply spend, right? So it's really then leveraging all this information to drive the efficiencies that you need with your organization. So again, just to kind of echo, it's pulling together what we've done so far on the clinical space, and then really now that we're beginning to focus back on the back office is how we bring this together to really support your organization and make timely decisions. So going back to, the supply chain maturity model, what we've been having a number of conversations now about with the organization, specifically since the pandemic, is what can I be doing better in order to be better prepared for what my demand may be. And we've started to now have these conversations with organizations, but really leveraging supply and demand planning functionality that, again, other industries have been doing, right? Manufacturing does this, right? Retail does this based on seasonality. And again, some of us have been doing some form of this in some way, but not really in any formal way, right? And not really with tools that can help us do this much more efficiently, right? So we talked about, earlier, the reactive, right? That's stage one. It's just a reactive, typical inventory management process, right? And then we're moving now into these cloud technologies where we can have much more real-time transactional data. We can begin to start looking at what our demands may be, and as we move up with supply planning, it's then really taking a look at and leveraging the analytics, evaluating what our min-maxes may be. We can make recommendations. The system can make recommendations around level changes. So let's try and reduce the number of supplies in maybe that par location at the end of the hall that doesn't get turned as much, right? And I know right now, especially with COVID, we're not talking about, minimize our inventory as much, especially for certain items, right? But we also don't want to go hog wild and be overstocking again, right? So, and then as you increase that maturity, it's overall looking at kind of based on seasonality, right? And again, we have tools that can do this, right? I can look at seasonality. I can plug in a number of what-if analysis, right? So you may be getting a new allocation from your distributor. What's that going to do to my demand, right? So with demand supply planning, you can plug in, I think I have a slide on this a little bit later, so you can plug in a number of different inputs in order to create what your demand might be. You can also then change variables on those things that might impact either your demand or what your on-hand quantities are going to be. So that might be things like, I know I'm going to get a new allocation. What's that going to do to me? Perhaps, we all know from the hurricanes in Puerto Rico, it impacted our solutions, right? So if I knew something might be happening or I'm hearing about something occurring, a demand planner within an organization go and do a what-if analysis, just saying, hey, what if something did occur and all of a sudden I couldn't get solution or I couldn't get X supply, right? They can just run that analysis, right? And it'll show demand. What if all of a sudden, like we've all been living through here, is you start changing your protocols? So, that's what we were you were all faced with, right? Is, I'm getting reduced quantities in. I'm now changing my protocol where I used to gown up and mask up on every floor. In every room, right? How's it going to impact my on-hand quantity? Well, now we know that our on-hand quantities are impacted. So what am I going to be able to do in order to, we're now reducing our usage to, we're going to give one employee one mask per day, right? And how does it impact my client on hand? So again, it's really leveraging the tools to be much more proactive and prescriptive, right? With ultimately then, when you reach the highest level of supply chain planning, it's taking that demand and feeding that into your supply plan, right? So that you can leverage to see what can I be getting, right? Can I look at other suppliers? And this is where, again, as an overall industry, we need to improve is how can we be working with our overall suppliers to do a better job of, assistance on what we need, right? So how can we be, ensuring that they're going to be able to supply us the supplies we need. If not, then need to go look at another supplier, right? We don't necessarily have all those lines of communication open just yet, right? So that's why we have this kind of crawl, walk, run model that you can adopt, right, as we move into more sophisticated demand supply plans in this space. Again, these are just some numbers that talk about, what we could be doing with supply and demand planning. Here's just an example of, forecasting your demand usage, leveraging this tool to really look at your PAR and stock levels. And then really, with this, and we're probably a little bit further away from this, is really using that plan to drive our replenishment. Again, other industries would use this from a manufacturing standpoint. I don't think that we feel entirely comfortable yet giving up control, but if you knew you had a rock-solid demand plan, and this could necessarily, if we're not thinking about a pandemic, right, but we truly are using these tools to pull in what our case schedules might be from our clinical side. We know what our on-hand quantity is at the moment. The system knows, based on average usage, what our fluctuations will be. It knows what open POs are out there, right? The system can make recommendations on here's when you should be dropping your next replen order, right? I mean, that's powerful, right? I mean, and again, it's not something that we're all comfortable with because to date, we haven't really been in that because we're in that reactionary mode. But if we get all these pieces lined up properly, right, if we have the integration, again, drive that operational excellence, right, if we're pulling demand in from our clinical side, we know what our cases are looking like. We know we have physician preference lines lined up properly. Again, as I mentioned, we know on the supply side of our on-hand quantity is. I know what my lead times are for my suppliers, right? Then let the system say, hey, more forward-thinking, think about, this is what your on-hands need to be. Let's go ahead and drop a replen order on this day, right? Again, other industries use this to make sure they have all the raw materials, all the components and parts they need in order to do their manufacturing, or even you think about retail. I did some work years ago in a magazine publishing company. They forecast out their major magazine company. They forecast out their issues of magazines a year in advance. They know, right, that the Christmas issue of Vogue magazine is this many pages, it's this thick. They go all the way back to paper mills and actually know what trees and what pulp is going to be used to make that paper, right? That's true demand supply planning because they're prepared for it, right? And they need to be prepared for it, right? I also learned that they use different types of paper between the magazine you get delivered to your home on a subscription versus the more expensive one you actually buy a newsstand. If you ever notice, actually nicer paper, right? But again, it's just a story or just an example of how other industries leverage supply and demand planning and much more forward thinking, and they're not sitting at that reactionary mode, and they're able to provide that level of service to their customers. So, here's the list of kind of standard inputs that we can make this happen. Again, these are all pieces we have. We may not feel great about all of them all the time. So when we talk about lead times, like, well, how do we get that, right? Sometimes we let our system calculate it based off, all right, here's my PO date, right? It's not hard to get, right? Here's my PO date, and here's when I got that fulfilled. That's my average lead time, right? Depending on what system you're using, some systems you just plug in. You just hard code when you're loading your supplier in, you hard code in 1, 2, 3, 5 days, whatever that might be, right? We really don't do anything with it, right? when you look at this list, in order to do it, a demand forecast, and I don't want to oversimplify it because I know we all know there's lots of variables here, right? But again, it's that crawl, walk, run. And all of these things here are things that we have, right? We know what our item master, we know what our contract terms are, we know what our suppliers are. If we pull all this together and feed it in, we can generate what that demand might be. You know, what value does this add to my organization? You know, again, it's ensuring availability and reducing excess inventory, right? So therefore, that's going to drive down our costs overall. We're going to have, you know, more improved min, max, and par levels. Hopefully, get ahead of the curve for some items, right, that might be on allocation. If we know, you know, if we're going to get warning that we might be begin a new allocation, we'll kind of go source that from somewhere else, right? I've had a number of conversations with organizations in the past few months where they've successfully, during the pandemic, gone out and were able to get pallets of PPE backed up with suppliers they never used. They were contacting overseas. I know a lot of you on the phone had to do that, right? And some organizations got hurt. Some got hurt, but more good, right? And I think we're all at a different place. But again, if we have that supplier plan set up, we'll be better prepared for the next time something happens. And again, I know right now, obviously the pandemic is front of mind, but we know we've had gown shortages before, we had solution shortages before. Like, this is much larger right now, but these are not things that aren't uncommon in our space, right? Overall risk management, which again is around the disaster, you know, just being able to compare scenarios for potential changes, right? So what if something does happen in a tragedy in a nearby area, right? How can I, and it really just be an overall better forecast, right? So imagine getting ahead of that and knowing what your supply spend might be based off of, you know, what's going to happen, you know, this fall, right? Or now we're going to walk into, you know, the fall here, pandemic plus flu coming, right? So what's my overall spend going to be? Do I think I'm going to be prepared for a manufacturer, or my distributor's going to be prepared for me? So, you know, this is just a high-level process flow. I went back and forth on a slide for here. We have some that are very process-driven. I kind of went with something just a little more cleaner for you to read. But, you know, it's taking a historical point of use and consumption, right? Doing your forecast, looking at what your inventory policy might be, you know, managing projected stock outs, and then, you know, ultimately would be, let's go ahead and do those automatic generation of POs and replen orders, right? If you're more advanced, so I didn't mention this, or not, I shouldn't say more advanced. If you're a larger organization, maybe you have a large distribution center, or maybe you have multiple larger warehouses, depending on your size, you can use this same tool to look to see whether or not you can just go ahead and supply yourself to another location and bring it over. You can use allocation rules so that based on, you know what your projection is going to be, what's coming in from your distributor, you can go ahead and prioritize, okay, the ED needs to get X percent of what we get, then the OR, right? So you can assign percents or allocations by department. You can very quickly adjust those if you have to, right? So if, like, you know, the more recent happening, if you know it's going to be the PICU, or sorry, if it's going to be the ICU or it's going to be respiratory, again, you can put a higher percentage of them versus, you know, that, you know, the floor 4 West is not going to have that many patients in the beds because we're not, you know, not going to be admitted to there, right? So I can go ahead and take those supplies from there. So lots of different variables that you can do around seasonality and just overall lessons learned that you can plug in or generate and kind of create that demand plan. You know, just some benefits of, you know, forecasting, you know, again, just accurate material needs, being more proactive versus just reacting all the time, reducing those things, and, you know, again, providing the service that you want to your clinicians so that they can be, you know, where they need to be, which is the bedside, or, you know, meeting with other clinicians to kind of make sure a smooth transition between patients, and they're not trying to fill shelves or locate supplies before they go off their shift so that the next shift can be prepared, right? You know, and I think ultimately it would be more that automation of your POs, your replenishment orders in order to achieve that. So that's really what I wanted to share with you today, is kind of what we wanted to talk about, you know, where organizations are on that maturity curve, but also keeping in mind as you're meeting with your leadership is, where's your organization going, right? What do you want to be doing? You know, we know there's lots of consolidation happening in this industry. What do we want to be doing around, from an organization, what our goals are, as I mentioned, around home health, visiting nurses, We know that more and more care is being provided outside the walls of the hospital, yet we spend most of our time managing supplies within the hospital, right? So where are you hearing your leadership wants to go from a health system standpoint, and how are you as supply chain leaders going to be prepared in order to do that, right? How do you bring yourself along that curve, right? I often share a story when we were working overseas, in the Middle East, they don't have the lead times that we have, right? So nothing gets through some of the Gulf country borders in under 3 weeks. They do a lot of very, I shouldn't use strong language. They do sophisticated demand supply planning, right? They can't get pharmacy and med supplies through their borders any faster than 3 weeks. They can't overnight things, right? So for years, they've been used as function. Now, do we ever need to be as advanced as they are supply and demand planning? Maybe not, right? But we also don't need to be in that reaction mode waiting for it. So somewhere in the middle is taking a look at, what is my demand going to be? Having a demand planner. It doesn't need to be a demand planner in every one of your facilities. It could be a function that you have that sits at the health system level, and they're managing the inventory levels. They're working with the inventory resources who are on that site and making sure the right supplies are at the right time. They're taking a look at orders or items that are sitting on the shelves for longer, so let's go ahead and rotate that through. Let's see what's obsolete. How much money are we wasting on items that are expiring, right? So it really is taking advantage of the technologies, right, and the functionality that other industries have been doing for a long time and applying it to our space. And I think right now many of you are going to be asked the same questions, and you're living those questions with everything that's been going on today. So that's all I had to share with you. I hope it was helpful.
Yeah, thank you so much, John, for sharing all that information with our listeners today. And we will now begin today's question and answer session. As a reminder, you can submit any questions you have by typing them into the Q&A box you see on your dashboard, and we'll get started right now. So the first question we'll go with here, the attendee asks, other than average daily, monthly, daily usage, how can you forecast demand planning when it is depending on patient health and global events? What is the best practice? We stock up on pre-flu season and a few key categories, but understanding demand of a hospital system are significantly hard to determine.
Yeah, so I'll answer that question. So, obviously, I think on that one slide there, we're talking about what the inputs are to our demand, right? So generally, you can start with your average monthly usage. You can even go back to look at what your historical demand is, right? So you can look to see over time. So oftentimes, I think seasonality plays into a lot of this. I think we often fall back on it's really hard depending on, because we don't know our cases, right? So yeah, we have cases cancel a lot. We have cases that get added last minute. But at the end of the day, I feel if you really look at what that usage really looks like, it doesn't fluctuate as much as you think it does, right? So we tend to fall back on that and say it's hard to predict that, but there are other industries and other scenarios that are just as hard to predict and more volatile than we have. So even just starting with your basic, your monthly or even yearly, right? Because you'll see seasonality anyway, right? We all know the stories that batteries go missing in December, right? All of our paper plates go missing during the summer for picnics, right? We also know that UTIs increase in the springtime, right? So we all know those balances are. We don't have to start with the entire health system and every supply you have, but I would say look at certain critical supplies. I believe that if you look at what that usage is, it doesn't fluctuate as much as you really think it does. And even if so, the system and the algorithms are very sophisticated. It can take a look at those things and accommodate for them. Again, I'd rather suggest to people that they take a look at using this type of tools versus just doing nothing and saying, well, it's really too hard to predict, right? I can't predict that. I think if you look at your usage, especially for your main medical supplies, it's probably much more predictable than you think.
Thank you so much for tackling that, John. The next question I have for you from an attendee is, the attendee wonders, how are you addressing the end user error component of this? And points out that the auto order systems often fail because you can't depend on the charge data to be correct.
Yeah, so can you repeat the last part, because you can't depend on what, the charge data?
Yes, it says the charge data to be correct.
Okay, so I'm going to kind of answer that in two ways, because I guess I'm not thinking about the charges right away, but I would say that Okay, I think I kind of know where they're going with as far as what was actually used in a case and charged out versus what my demand is. So I think there are definitely things you can do to address end user. One is obviously remediation and training to make sure they are entering things timely. There are, as I talked about, the anomaly detection that we can now start leveraging to say, hey, this doesn't look right as an order is something else that we could be leveraging there. I would say I would also think of this question a different way when I don't really want to trust my auto order because I just don't trust my on-hand quantities. And I think when we look at that, it's because we have broken processes earlier in the supply chain, right? So many orgs, and I did lots of ERP implementations. They just don't trust a replen order, right? That comes out of the storeroom. Well, why? Well, because you have people that are coming in and they're taking stuff out, right? And you're not issuing out properly, or you're not receiving timely, right? So there are often things that we need to fix from a process standpoint in order to have the integrity and the trust that we need in our on-hand quantities or our auto reorder quantities. So oftentimes, again, if we don't trust our auto order number, it's probably because we have something broken earlier down. When we look at other industries like retail and Lowe's, right? Like a large box organization, they issue everything in, they put it on the shelf, right? And then when people buy something, it's, inventory is decremented. They have a pretty good sense of what they have and they can trust their auto orders. We have a lot of immature things going on, and we have a lot of broken processes earlier in the supply chain that I feel are giving us those auto orders, the numbers that we don't trust, right?
Thank you so much, John.
Until you're comfortable with those numbers, I'll just add, until you're comfortable with those numbers, let the system suggest a number for you, right? You can always go validate that number, and if something's off, find out why, right, and fix the problem. And then, in order to kind of build us up. Again, we're not all going to be comfortable right away with just doing auto order. That's why we had that crawl, walk, run.
Makes a lot of sense there. The next question I have for you is, how do most of your customers move into the cloud?
That's a good question. So I would say earlier on in the cloud days, there was generally a burning platform, right? So an organization, their HR may have had, their HCM may have had more of a burning platform than say their financials or SCM. So they would start with maybe HCM, get payroll and benefits that are all live and running, and then they would have, interface then go into their financial supply chain system, and then they would go up with finance and supply chain next. Then the opposite was true, right? With some organizations that they were going to go towards a shared service organization from a procurement and inventory standpoint, open a distribution center. So they went finance and supply chain first, and then would do HCM at a later date. More recently, most of our customers have been doing the multi-pillar approach and going up with all the systems at the same time. And what I mean by that is not say on the same date, but they're going live with all three with a specific rollout strategy, right? So it would be HCM, then very quickly then go with finance and supply chain, or some going live all at the same time, right? So I would say now they're more going in bigger, big bang and multi-pillar, but there's definitely ways you can do it by function or even, within business, depending on how you want to do it. Finance and supply chain tend to be done together just because there's such an integration between the two of them.
Excellent. Thanks for laying all that out for us there. The next question I have, the attendee wonders, does the Oracle ERP have the analytics to perform cost per case and cost per case per physician?
We do. I know it's kind of a hard to read, but that was some example of the analytics I was showing you. So then pulling in now, right, again, driving towards the operational excellence is we've done a great job. We focused on clinicals for a long time. Now we need to get back and focus on the ERP. We do have analytics, and we have the repositories by which you can be pulling in your clinical data, and you can marry that up with your financial and ERP. And I'd be more than happy to kind of go over that more with whoever's asking the question. I think my email is on thing, but we can even share that with you. But again, it's leveraging the data and pulling into one spot by which you can do the analytics.
Thank you so much, John. And for the next question, I believe, we've touched on this already somewhat, but I think it's just a good opportunity to review again. So what does Oracle have to help supply chain management for potential customers?
So we have a full-blown supply chain solution that would whether it be what we would call the core ERP, so everything from your self-service procurement through procurement and PO, inventory, inventory management, and then depending on, so we have, to run your supply chain today, we have, it's implemented in a number of organizations now run our supply chain solution, and then depending on where you are on that maturity curve and what you may need, we have then also warehouse management, full-blown warehouse management solution, demand supply planning. That can be run separately, and even without the core ERP, you can run and feed our demand and supply planning modules in order to generate that demand that you need. So we offer a full, we have a product data hub that can stand alone as well, so you can maintain and manage your item master, and even if you want to push it into your legacy ERP, you can do that as well. So we have the tools needed to run your supply chain and drive you along that maturity curve.
Thank you for giving that overview, John. And the next question here is a little bit longer one, so I'll work through it and present it to you. So the attendee wonders if this is sort of an introduction to Oracle's ERP solution with supply chain solutions. Is it meant to be a substitute to what healthcare providers have already invested in, related to interfaces or integrations with their EMR? Does that make sense?
It is. I'm just rereading it again. So no, it's an interesting question. No, the presentation wasn't designed for that. What we wanted to do was share, as I mentioned earlier, and maybe I hope I got my point across, is that there was a significant, and I know we're going back years here, but there's a significant push in the legacy ERPs to get them in. We had to get legacy ERPs in for Y2K and a number of other issues, right? There was a big push to go to integrated platforms, right? One platform. And then we kind of got away from that again. We started to see a bit more of a best-of-breed solution, right? And then, as I mentioned, then there was obviously the big push in regulation around getting a clinical, electronic health record in. And we kind of lost sight of what was happening in the back office. So to really address that question, it's really, well, how do we get to the next level, right? Are we going to go through this again where we just kind of do, this is ERP wave one all over again? Well, no, it's because we have a number of customers, a number of organizations that we know there's a burning platform. We're on legacy technology, and yes, there are now these new technologies available through cloud solutions, right? So it wasn't to be just around Oracle's ERP solution in lieu of, right? It's where do you need to leverage technology in order to take your organization to the next level, right? Because the clinical systems are now in. We're sitting on legacy age technology, that we're running our back office on, and now you begin to take advantage of these new back office systems, right? ERPs, Oracle being one of them, but there are other players in the space, right? That are built on cloud technologies. You can't get these. It's more difficult to run these chatbots and IoT and blockchain and some of the more predictive analytics on legacy technology. The technologies can't handle it, right? So it's really what we want to talk about is how do you move your organization from, a legacy platform into a more cloud and modern platform that lets you take advantage of disruptive technologies, lets your supply chain be more resilient so you can be better prepared for things like COVID-19 or, as we know, mergers that are going to be happening, consolidations are going to be happening. So I hope that answered the question.
Absolutely. I think those are some helpful clarifications there that gets at the heart of what the question was about. And so the next question I have for you, John, from the attendee is, what auto ordering capabilities do you have out of the box?
So with the, you can do auto order from a storeroom standpoint, and depending on how your inventory is set, you can do what minutes are triggered, and if you have the contract set properly for your items, you can auto order and push it right out the door. We do have demand supply planning that you can push and order, a plan back in and let that auto order today. So that functionality exists today in the cloud. Do we have many organizations within our space that are doing that? No. Again, because I think there's other things we need to be fixing along our supply chain, but that capability exists today in our cloud solution.
Excellent. Well, thank you for tackling all those attendee questions, John. Really appreciate it. We're coming up to a close of our time here. So I just want to ask if you have any closing thoughts, any final words for our listeners today.
No, I think I hope it was helpful. I enjoyed having the conversation. I did see one question around the maturity model. It's not clear on how our modular solutions will apply. If whoever wrote that wants to reach out to me, we can talk about it. Again, I didn't want to be just around kind of Oracle module to the discussion, but we can certainly support each of those. And I have a presentation on how you go along that maturity curve and how there's different modules you can use to help you support that. So, I would say, the last thing I would say is, we as an industry, I think we're primed for us to be moving our supply chain along. I think that with what's been happening today, we know we need to get more proactive around our supply chain. And again, that doesn't need to be in every supply in your warehouse, but there's certainly going to be some supplies that we do a better job of. And really, it's leveraging our relationships with our distributors in order to help us kind of move along that chain, because we will continue to sit in that reactive mode if we don't take advantage of these technologies and really think about how we want to run our supply chains in this industry, because we've been kind of running it in that reactionary mode for a very long time. So I think my contact information is on one of the slides, but feel free to reach out if people have any other questions.
For sure, and I know from the Becker side we'll help facilitate connections there. John, thank you so much. It was a great presentation. Really appreciate you taking the time to walk all our attendees through that today. And I want to thank Oracle as well for sponsoring today's webinar. Enjoy the rest of your day, everyone, and we look forward to having you join us for future webinars.
Okay, thank you.